Studies show that 35% of the population have difficulty swallowing pills, which includes vitamins. If you are one of those people, injectable vitamins or IV therapy may be exactly what you need. Dr. Jenny Wilkins, owner of Age Vital Pharmacy Research and Wellness, joins us now to talk more about this. Dr. Jenny, okay, good to have you back.
Thank you. Always fun.
What's all the fuss about this, and when's a good time to have this done? Either an IV for vitamin therapy.
I love IV therapy or even injection therapy where you're taking a vitamin, you know, in the tush or in the arm, and then you're doing mega doses through the IV. So usually people will come into the, the IV centers. My favorite here in the Tampa area is Replenish IV. And I have several in the Sarasota area like Hydrate and Dr. Karen Brainerd and Dr. Grubbs. Those are the ones that I really recommend because they get all their stuff from me.
Yeah.
But usually they'll send, when they're writing the scripts for it, for us to prep bags, it's for, cancer patients going through chemotherapy and radiation, because it really just helps fertilize and water your body, because you're giving the body exactly what it needs to heal itself. And most often, a lot of these doctors have a lot of success doing just nutritional IV therapy before going to chemo and radiation.
Okay.
They're getting rid of tumors and cancers and things like that with CoQ10 and vitamin C and mega doses of vitamin A. So that's a big preventative thing. There's so much research out there right now on, IV therapy, just for preventative purposes. Now, I have a lot of athletes that also go to these centers for, post-athletic, drips and pre-athletic drips to help support whatever sport they're doing, like a lot of the NFL football players and the baseball players, I'm thinking of the Orioles, things like that.
I'm thinking of Rihanna right now, when she was on one of her world tours and she showed herself hooked up to an IV getting replenished with fluids.
It's hot right now. All the celebrities are doing it. It's so popular in Boston and Miami and California.
But is it healthy? But is it okay?
Oh, absolutely 100% okay, especially when you're so deficient and depleted.
Right.
Because then when you're so exhausted, you're going to get sick, you're going to get run down. So you need to treat your body like a car and regenerate it. Saying, okay, I'm going to rotate your tires and check your spark plugs. And that's that IV drips. The popular one's the hangover drip, too.
Oh, gosh, yeah, I've heard of that.
Go use and abuse, alcohol, and they just party till 2, 3 o'clock in the morning. And then they'll have some of these IV centers that go straight to their house.
Right.
They'll bring them to your work, get rid of, migraines and headaches and the hangover. Just get rid of all that alcohol.
What's the difference between what you're putting in your mouth, though, and what you're putting in your vein?
Your gut can only absorb and metabolize so much. So you're thinking once you're taking a pill, you're only metabolizing about 20% of that. So when you're doing it in the IV form, you're metabolizing the whole thing because it's completely bypassing the gut.
Right.
So, and you're doing mega doses. So as opposed to taking a 500 milligram capsule of vitamin C, you're doing 10,000 milligrams to 50,000 milligrams of vitamin C.
Would that not cause you to have major diarrhea?
Oh, no. The women use the vitamin C drips for anti-aging purposes, so their skin doesn't look plump or, rejuvenated. Really hydrates. They walk out of these IV centers without wrinkles.
But you say the word needle to somebody, and that right away, a lot of people get freaked out, even the thought of that. So, I mean, is it the needle you think of when you were a kid?
Yeah, I used to be a little standoffish, like, oh, vitamin injection. But then once I had my first, I'm going, oh my gosh, I had so much energy.
And is it going into the fat, or is it?
There's some that go into,
muscle?
Into the muscle, and some that goes into the fat. So subcutaneous injection, into the fat, and intermuscular injections in the tush.
Okay.
So you really don't feel it. And you got to make sure you're going to a licensed facility, that actually has a real medical doctor that's able to, hospitals are full of IV drips. When someone gets sick and they go to the ER, what are they giving them? They're hooking them to an LR bag, which is electrolytes.
Okay.
And that's just plain electrolytes. And they'll charge anywhere from $3,000 to $6,000. Insurances don't cover that.
Okay.
You go to one of these centers like Replenish or Hydrate, you're paying $50 to maybe $200 for a drip that has more than just electrolytes in it.
All right, for tests to find more natural ways to live better, you can reach Dr. Jenny and her team at Age Vital at 888-388-7237 or go to agevital.com. And if you have a question for Dr. Jenny to answer right here on Daytime, email her, Jenny@agevital.com. We'll be right back.